Hi, I'm Yixuan. It's glad to share my project here. This project builds an AI-driven drug design pipeline using TargetDiff to design selective inhibitors for the EGFR T790M resistance mutation in lung cancer. T790M affects up to 60% of EGFR lung cancer patients on first-generation drugs, a single amino acid swap that blocks drug binding. Osimertinib overcomes it, but resistance keeps emerging. 3 questions. Can TargetDiff generate valid drug-like molecules from EGFR pockets? Does pocket conditioning produce T790M selectivity? And if not, what can we do without retraining? Here's the pipeline. 10 notebooks end-to-end. To crystal structures in, TargetDiff generates nearly 1,000 molecules per pocket. Then drug likeness filter, cross-docking, ablation experiments, and SAR optimization. The central result is that 153 molecules docked against both pockets. If conditioning worked, the red T790M condition points would cluster above the diagonal. Instead, both pools overlap completely along the equal binding line. That side, baseline drugs behave correctly, so the particle is valid. The model just don't differentiate. Here's the interactive version, my demo A. The x-axis is the wild-type binding, y-axis is T790M binding. Lower is stronger. Above the diagonal is T790M selective. Below is wild-type selective. You can see the Jaffatini sees these points below as expected, and Osimertinib this point above the diagonal. The particle is confirmed. You can also hover any point for smells, scores, and delta. And why does the model fail? Tighter pocket radius just generates fragments. Structural similarity to Osimertinib shows zero selectivity correlation. The root cause is that the training data treats every protein independently. The model has never seen a mutation pair. That's a model boundary, not a bug. But experiment C identified pharmacophore-confirmed candidates. They are my SAR starting point. So here's my demo B, shows the top 10 candidates as report cards. Each card has a structure, binding scores, and pharmacophore boundaries. You can see the card number 9 here. The NH, ARN, and ARMPI all light. That bench combination flags SAR responsiveness and exactly why we run CN substitution on this scaffold. Is my systematic SAR results. 8 substituents, 5 scaffolds, and 80 analogs. You can see NH hinge plus aminopyrimidine scaffolds shows 54 to 75 improvement here. CN works best, then F. OH and NH2 are universally harmful. Bicyclic scaffolds without NH hinge locked at 0 to 4%. Mechanism is that T790M opens a hydrophobic back pocket. Electron withdrawing groups fill it, and polar groups don't. Then the best results rank number 9 plus CN, delta from minus 0.4 to minus 1.74, 4 times improvement and 6 times stronger than Osimertinib. QED 0.87 is also higher than all 3 approved drugs. Molecule weight is 322, smaller than all of them, leaving considerable room for further structural optimization. And unlike Osimertinib, no covalent warhead means lower off-target risk. In conclusion, the model TargetDiff is pocket conditional but can't differentiate mutation pairs. It's a training objective limitation. But SAR closed that gap, delta minus 1.74, drug likeness exceeding all approved references. The next step will be IC50 validation, and on the model side, contrastive training on mutation pairs is the most promising direction. Thank you.